shout out to our AV crew for doing such a great job and going with the flow with everything. Thank you so much. I'm so thrilled to introduce our next speaker, Jackie Bowers. You might know me from our wellness program at the IWMF. My name is Ann Grace. And I met Jackie at a Living Well with Blood Cancer event sponsored by LLS last year in November. I think it was November. And she was doing a presentation on this topic, this very topic, integrative oncology. And I saw her and I thought, I want to bring Jackie to our group because I think her perspective will be very useful. I thought she would be a great fit for us. So a little bit about Jackie. Not only is she an incredibly talented licensed massage therapist with 17 years of experience and training, and this is very important, and you're going to learn a little bit more about this, training in oncology massage. She also knows the importance and efficacy of integrative oncology in whole person cancer care. Right? So she's got a very broad knowledge and grasp of integrative oncology. She has worked directly with blood cancer patients via a number of facilities you may have heard of, such as the Sidney Kimmel Cancer Center and the Integrative Oncology team at the Children's Hospital of Philadelphia, and that's my hometown, and it just warms my heart that the work that Jackie is doing for so many folks. She's also founded a company that crafts hemp-based topicals for joint and muscle discomfort called Joint Untypical Topicals. And I'm telling you about this as almost a recent convert because I have seen the effects of her products directly on our IWMF staff as of today, who was having some really bad tension in her neck. And Jackie, ever the compassionate soul that she is, said, here, try this. A topical that was very, very helpful, but mostly these are used in this setting that we're presenting to help cope with side effects from cancer treatment. So Jackie, we are very, very grateful that you could travel here to be with us for our very special weekend. And so I'd like us to give a warm welcome to Jackie Bowers.
Thank you for the introduction, Anne, and thank you all for being here and being interested in this topic. To get our mental juices flowing, it's the end of the day, end of a 2-day conference. We're all a little tired. I wanted to start with a tool that if you don't remember anything else from this presentation, it's one little easy take-home tool that you can use to manage stress. This tool comes from a very well-known neuroscientist named Andrew Huberman. Maybe you've heard of him. He's wildly popular right now with a podcast, Huberman Lab. He's out of Stanford University, and he teaches this technique called the physiological sigh. And he recommends this as one of the quickest ways to reduce a spike in anxiety. He recommends it during acute times of anxiety, but also for times when we need to quickly reset our focus and for public speaking. So I'm going to help you all and help me. So this technique involves 2 breaths in through the nose and 1 out through the mouth. So the 2 breaths in through the nose, the first breath is a longer inhale followed quickly by a shorter inhale and then a longer exhale through the mouth. So let's do it all together. 2 inhales. 1 more time. So that's called the physiological sigh. When you're in a time where you just feel stress mounting, you can pull that out of your toolkit and see what it does for you. So our topic today, integrative oncology, caring for the whole person. To get us thinking about what does this mean, the whole person? Think about that question that we all get. How are you doing? Such a simple question, but it can feel overwhelming, right? Because when you think about it, well, how am I doing? Do you mean physically? Am I getting enough sleep? Are you talking about my work? Am I anxious or hopeful about the future? We have so many moving parts. There's our health, our families, our finances, our hopes, what brings us fulfillment. So a lot of the time when we're asked this question, it's easier just to say, I'm fine, because really, where do we begin? And yet, when it comes to healthcare, and especially care if you have a Waldenstrom's diagnosis, we have to begin somewhere, and that's why I'm here today presenting this information about integrative oncology. Integrative oncology really addresses exactly that, the whole person, not just the disease, not your symptoms, but you, the human living inside of all of that. Perhaps you're the person who might be thinking something like, wow, I'm finally at a time in my life where I have a little more time to get out and enjoy my golf game. I'm going to try to improve things a little bit. But I have so much fatigue from Waldenstrom's that when I get myself out there, I just don't have the same joy from it. It's a real struggle. Or maybe you just got some pretty good lab results and you're feeling some relief from that. But at the same time, you're thinking, well, I really hope this holds up because my 91-year-old mother just took a nosedive into dementia and I have to figure out her care. So these are the things we're talking about when we talk about whole health. Today, what we're going to cover more specifically, what exactly is integrative oncology, the role of complementary therapies. We'll look close at a few of these: acupuncture, massage therapy, yoga therapy, the importance of stress relief, which is sort of woven through this entire presentation. We'll talk about a few other complementary therapies in brief, some things you can do at home, and some resources. So what is integrative oncology? Integrative oncology combines conventional cancer treatments with complementary therapies that are designed to enhance your quality of life. It addresses the physical, emotional, and spiritual well-being. And when we say spiritual, we're not talking about any religious system. We're talking about you tapping into your inner guide, the things that keep you grounded and on target. Because when we're going through challenges, it's easy to disconnect from that inner guide. So when we think about integrative care, I like to compare it to a gardener who tends to a tree. Rather than simply pruning branches that are overgrown or, oh, let me throw in some fertilizer, trees looking a little unhealthy, the gardener takes a holistic approach, looking at the entire environment. They might assess the trees, the soil quality around the tree, ensuring it's getting enough hydration, enough water, and monitoring its overall growth. How is this tree thriving or just barely making it? So in integrative medicine, care works similarly. Instead of just treating symptoms with medication, providers look at the entire person. They might suggest lifestyle changes like nutrition or exercise, or emotional support through counseling or stress management, And even explore spiritual practices, mindfulness practices, meditation, things that might resonate with you specifically. So just as the gardener nurtures the tree from the roots all the way up to the leaves, integrative approaches look at the entire person. It looks at the immediate health issues, the things that are going to keep you alive, but also has a focus on long-term resilience. Why is this important? It's important because cancer treatment presents numerous physical, emotional, and spiritual challenges that conventional treatment does not always fully address. We know that conventional medicine may treat one problem, but then create an unwanted side effect. So if we go back to that gardener with the tree, when the tree faces a severe pest problem, the gardener may choose to use an intense pesticide to keep that tree alive. However, that treatment can have unintended consequences. Perhaps beneficial insects are killed. Perhaps the soil quality is damaged. So similarly, cancer treatments like chemotherapy can effectively target the cancer, but have some unwanted side effects. So this gardener with the tree is going to observe the tree's response. Perhaps the gardener notices leaves drooping, branches weakening, not just from the pest issue, but from this intense pesticide. So the gardener might have to take extra measures to support the overall health of the tree, maybe enriching soil quality, providing adequate water, carefully pruning so that there's still healthy growth. So in the same way, integrative health steps in to support the whole person, because there are multifaceted challenges that arise during treatment, not just the physical aspects, but integrative care provides emotional support and spiritual nourishment during a challenging time. So one of those complementary therapies that's used in integrative medicine is acupuncture. Acupuncture is becoming more and more widely used, even in hospital systems around the country. So what is acupuncture? Acupuncture in traditional Chinese medicine, acupuncture points are situated along meridians or channels that run throughout the body. Qi, it's spelled Qi but pronounced Qi, which means energy, is said to run through these channels. When Qi is obstructed, disease and illness or symptoms may present. Acupuncture is employed to promote healthy flow of Qi through these channels and to help alleviate symptoms. This is done by inserting needles along different points along these meridians. From a Western medicine perspective, these needles are known to trigger the release of pain-relieving and mood-enhancing chemicals in the brain. In fact, MRI studies show that acupuncture causes changes in the brain that reflect changes in the body. So for folks with Waldenstrom's, how can acupuncture help you specifically? It can help with pain and neuropathy. If you're someone who has to go through chemotherapy, it can help with nausea that may result, anxiety, which can be throughout from diagnosis to treatment, whether you're in a watch and wait phase or you're in active treatment. We also just live in a world that's chock full of anxiety and fatigue, which I know can be significant with folks with a Waldenstrom's diagnosis. Additionally, acupuncture can enhance sleep, boost blood circulation, and potentially reduce inflammation. One of the most well-documented Benefits of acupuncture is pain relief. Research published in the Journal of Pain and Symptom Management indicates that acupuncture can lead to significant reduction in pain among cancer patients. A meta-analysis published in the Journal of Clinical Oncology found that acupuncture significantly reduces chemotherapy-related nausea and vomiting. By targeting specific points, acupuncture can effectively create a shift away from nausea. And I just wanted to take a moment to show you what one of those points is. If you look at your forearm and you find this crease of your wrist, and then you're going to take 3 fingers down from the crease, and right where this third finger is, you're going to find there's those 2 tendons. Do you feel those that run down your forearm? So it's where that third finger is, but right in the squishy part between those 2 tendons. In Chinese medicine, that point is called PC6. And when either a needle is placed there or simply pressure with a thumb or a finger for 3 minutes or longer, patients report a shift away from nausea, a significant reduction in the feeling of nausea. This is so well known that you can even find things like this to purchase online. These are called AcuBands. I know you're far away, we're in a big room, but there's a little plastic piece, and it's designed to put on your wrist, and you can place it right where that point is. And these can stay on for several hours. People use these for seasickness too. Sometimes if you look online, you can also Google C-bands. So it's a well-known built-in tool your body has to create a shift in your symptoms. Acupuncture is generally safe for cancer patients and well tolerated. Some specific conditions related to cancer treatment, Waldenstrom's diagnosis, may require continuous treatments for long-term benefits. An initial treatment with acupuncture for some folks feels subtle. It is said to have a cumulative effect, so if you decide to try it, I recommend trying a few sessions and see how you do with it. Who here has had acupuncture before? Nice to see a few hands. The rest of you might wonder, why would I want to have needles placed in my body? That does not sound relaxing, does not sound pain relieving, and it sounds kind of weird. So sometimes it helps to know what to expect, right, when you're doing anything in life, if you have a little preview. So again, you're far away, but I brought an acupuncture needle here. And these are not like a needle used when you're receiving an injection or an IV. In fact, if you can see here me waving my hand across this needle, it's bending. It's like a cat's whisker. It's as thin as a hair. So if you go for an acupuncture treatment, the needle comes in a little sterile tube, and an acupuncturist will simply find the appropriate point and they just press it in, and it's as simple as that. Most people, you might feel little sensations, zings and zaps. Most people find it pretty relaxing and fall asleep during a treatment. Needles can be placed in various parts of your body, from points on your arms, sometimes even around your eye, ears, in your feet, and so forth. If you decide to try acupuncture, it is a state-regulated therapy. So you just want to make sure you're going to someone who has the appropriate licensure and certifications. And you can also ask questions. Have you ever worked with anyone with a Waldenstrom's diagnosis or a blood cancer or cancer in general? There can be some contraindications. If someone is severely neutropenic or has severe thrombocytopenia, platelets are low, an acupuncturist may decide to hold off on a session. It's case by case, just like your doctor, you all have been talking to each other, one person might do well on one dosage of medication where for another person it has to be adjusted. So as a practitioner gets to know you and what you tolerate and what's your baseline, they can adjust a treatment plan according to you. Massage therapy. Massage therapy is generally more widely utilized, more known in this country than acupuncture. But from a clinical perspective, it does provide relief for pain, anxiety, can help alleviate depression, fatigue. It can help regulate GI issues like constipation or if you have inflammation in your gut, and peripheral neuropathy. There are numerous studies that have emerged showing that massage is effective in pain relief. We often think of massage as a way to relieve stress. We think of it releasing tense muscles when we're stressed. Often the first part of our body that screams out is our muscles. Our shoulders might be up to our ears. We get all this tension in our neck and so forth. So massage can help relieve all of that. It can decrease stiffness. But more than that, it creates a nervous system response. There's a release of feel-good chemicals that your body makes all by itself, endorphins, which are the body's natural painkillers. It has been shown to reduce stress hormones like cortisol. And another hormone that maybe you've heard of, oxytocin. Some people call that the love hormone or the bonding hormone. It's the hormone that sends a message to you on a cellular level that you are cared for. Massage is linked to a boost in oxytocin, and the other benefit of that is oxytocin has an analgesic or pain-relieving benefit to it. And it can help reduce the perception of pain and discomfort that might come with things like peripheral neuropathy. And when it comes to peripheral neuropathy, there's evidence showing that sensory stimulation through touch can help shift the tide a little bit and lessen the impact of the uncomfortable sensations. Your skin contains numerous receptors that respond to touch and send signals to the brain, not just for relaxation, but it kind of disrupts that pathway of discomfort. You know, when something in our body hurts, it sends a signal to your brain sends a signal back, a pathway is created. So sometimes something sensory like touch can help lessen that pathway that we don't want anymore. Massage also is a great time to just disconnect, get grounded, get out of your head and back in your body. When it comes to massage, if you are, this can vary depending on where you're at in your diagnosis and where you're at in treatment, but it can be helpful to see an oncology-trained massage therapist. Oncology-trained massage therapists have specialized knowledge about your diagnosis, about what you might be going through, things like peripheral neuropathy. For blood cancers, sometimes your blood count matters when it comes to how much pressure is used. So they know how to keep it safe but still effective for you. What you see on the screen here is a scale. created by a woman named Tracy Walton. She has pioneered oncology massage in this country, and she created a scale to help us talk about the amount of pressure used. We know it's subjective, you know, if you've gone for a massage and they're like, how much pressure do you like? It's hard to, it varies from person to person and from therapist to therapist. So this is a helpful scale to indicate what type of pressure. For folks going through chemotherapy, the recommendation is to stay in the 1 to 2 zone, 3 max. Because when you're going through chemotherapy or other intense treatments, your body's doing a lot already to deal with that. And even though you might want someone to stick an elbow in your trap, the next day you might feel like you got in a car accident. Depending on what your blood counts are, there could be bruising. So there's this misunderstanding in the world of massage that to be effective, it has to be really deep. And sometimes, depending on where you're at in your health, that's okay. But for folks with a Waldenstrom's diagnosis and cancer in general, there are special considerations, and it helps to go to someone who understands these. An oncology-trained massage therapist is going to know not to work at a site where there's tumor involvement, should that ever be a situation. And a contraindication for massage, no matter who you are, is you should not get a massage when you have a fever. So if fevers are an issue, you need to wait until that fever passes, and that's for anyone, because a massage can elevate a fever. But we'll talk more. There are other things you can do if fevers are an issue. And also, if you have an active infection, that would not be a great time to get a massage. You have to wait until that gets under control, because massage could possibly exacerbate that. In your handout, I included a self-massage protocol for peripheral neuropathy. This is very, very simple and self-explanatory. It's a little 5-step protocol, but basically starts with, you know, if we're talking about neuropathy in your fingers, you're going to work from your fingertips to your elbow. You can just start with, you know, get some lotion at home, or if you have a massage oil, and you're just going to just get tissues warmed up by just giving yourself a massage down your fingers, palm, down to the elbow. Then step 2, you're going to get a little more targeted. You're going to go down each finger, down your palm, all the way down. Step 3, you're going to get even more targeted, a little firmer. You're going to go down each side of your finger, or if it's your toes, all the way down your palm in little firmer strokes, and then down your forearm. And then, of course, you can finish up with just a general massage in the area. But doing this, you don't have to make a big project out of it. You know your times of day when perhaps you feel these symptoms the worst. You can just pepper this throughout your day. Keep a little lotion handy. If you're working, you can keep it in your desk, at home, next to your chair, if you're watching TV, computer, whatever, and just give it a try and see if it helps. I call all of these little things free experiments. You don't need an appointment. They're just things you can try at home. Yoga is another amazing therapy that is so incredibly supportive during treatment. What is yoga? Yoga is a practice that combines physical postures or poses with breathing techniques, mindfulness techniques, and meditation. You can see on the screen, it has been shown to promote anxiety and stress relief. It can also help create balance in your gut, relieving constipation or reducing inflammation. It can help combat fatigue. It can also play a role if you're someone who is going through chemotherapy and you have nausea. It can help reduce the effects. Pain management, those same feel-good chemicals we mentioned with these other modalities, yoga provides the same release. And then there are yoga techniques that can also help lessen the impact of peripheral neuropathy. In terms of anxiety relief, a yoga practitioner may instruct you with breath practices. There's one called bee breath that Anne Grace can instruct you on that WMF's wellness program coordinator and amazing yoga instructor, and belly breath is another one I'm a big fan of. These things have been used for a very, very long time, and they're simple things that you can do to just create, they're not magic buttons, but they're things you can try out and incorporate throughout your day to just create a shift. Mindfulness practices that are used in yoga can help you get out of what-if scenarios, especially if you're in a watch and wait phase. That has a combination of relief that you don't need treatment right away, but then it can lead you into a spiral of what-if scenarios. And so mindfulness practices used in yoga can just bring you back to the here and now, what's happening right now, because that's the only thing we really have control over, right? As I mentioned, there are yoga postures that can help with constipation. Some medications cause constipation. Some of these poses can almost be like they're massaging internal organs and can create balance. Nausea, from a yoga perspective, yoga is informed by Ayurveda, which is a traditional system of medicine that originated in India about 3,000 years ago. According to Ayurveda, nausea is caused by upward rising energy. There are yoga techniques that can create a shift and bring that energy back down, providing you with relief. And as I mentioned, yoga can help with peripheral neuropathy. When you're experiencing peripheral neuropathy, other things come along with that, challenges with your balance and coordination. These things can lessen. A yoga practitioner can help you regain some of that balance and coordination, and especially IWMF has this wonderful wellness program built in, and the advantage of using those resources is that the practitioners know exactly what you're going through, and the techniques can be tailored to you specifically, rather than just hitting the random yoga studio in your neighborhood. You can find amazing folks there too. You can do some research, but I'm encouraging you to take advantage of the resources that are at your disposal. But yoga is a wonderful marriage of mindfulness and movement, and I cannot stress enough how beneficial movement is, not just from yoga. I was talking to some other folks the other day, some fans of Pilates, sometimes just going out for a walk. Even if you're experiencing extreme fatigue or neuropathy, getting yourself to do something is going to release a flood of chemicals in your body that support longer-term resilience. So try to do something. And it helps to team up with other people. These classes are via Zoom. Seeing other people going through the same thing helps you to do it. It's better to do something rather than nothing. The topic of lymph health has come up in talking to folks over the weekend, and I just wanted to mention that briefly about lymphatic massage. The same things would apply that I mentioned earlier. You wouldn't want to have that done while you have a fever or infection. But when it comes to healthy lymphatic flow in our body, movement is one of the best things you can do to support that, to be honest. Our lymphatic system doesn't have a pump like our blood does. There's not a separate heart for your lymphatic system. It circulates through your body via muscle contraction. So when you move, you're promoting healthy flow of your lymphatic system, which of course is going to support your overall health. So do not underestimate the power of incorporating movement throughout your day. There's back to Huberman, our neuroscientist. He has presented research on walking. When it comes to stress relief, when you walk, there's a very slight eye movement back and forth. You're not even aware of it, but this eye movement is connected to part of your brain that also helps flip the switch from fear, anxiety, stress to, okay, I can handle life today. So, people will say, like, I just got to go out and walk and clear my head. Well, that's a real thing that's happening on a physiological level. So when movement is just great for your muscles, relieving stress, your lymphatic system, but it is just great for your state of mind. So get yourself moving in one way or another. So stress relief, which obviously we've mentioned many times already, stress relief is linked to better outcomes. Emotions like awe, joy, and gratitude are associated with beneficial shifts in your biochemistry that are measurable. For example, positive emotions such as excitement or awe have been found to lower levels of pro-inflammatory cytokines, which are small proteins that are connected to disease, health issues, inflammation. So emotions are communicated through your body via chemicals, neuropeptides, and so forth. So when you experience a positive emotion, it's like giving yourself a little injection that's going to support your overall health. Perhaps you've heard of laughter medicine. There have been phenomenal studies on humor. There's a great study that I love that was for diabetics. 2 groups, all insulin-dependent diabetics. Both groups would typically need insulin after eating a meal. One group has their meal, other group meal plus an hour comedy show. The group with the comedy show did not need their usual injection of insulin. So it's powerful. Once you start diving in, it's mind-blowing. There's a famous book from years ago by a man named Norman Cousins. Perhaps you've heard of him. He created a dramatic shift in a debilitating arthritic condition by watching 2 hours of comedy a day. I mean, at this point, his condition was so advanced, he was bedridden, so he could do this. But he went on to live many, many more years and enjoy a nice quality of life. So think about how you spend your time. Surround yourself with people that are fun, that make you laugh, or other things that just bring you joy and light you up. It can be little things. Sometimes I just find myself, when I'm stressed, I make up improv songs about my stresses. Whatever floats your boat, just find a way to bring it into your day. Sometimes drawing on what I call the little insignificant experiences in life to help you kind of climb up that rung, the emotional ladder, get to the next rung, is drawing on something that went well for you and think about how that felt in your body. I mean, it could be as simple as you were running late for an appointment and you're stressed about it and you get to the place and there's a parking spot right in front and you have that like, yes feeling, and you get in the spot and you get into your appointment, and whoever you were supposed to meet with had a last minute phone call, so it buys you a couple of more minutes and you can just slither in, and it's like you've been there the whole time, and it's that feeling in your body of relief. I mean, it's a silly example, but think about how when you have that actual physical response, I'm like, yes. So try to draw on things in life where you've had that feeling, and then create a future memory with it. Just, again, I call these free experiments. You don't need an appointment to do these things. Just see what kind of shift you can create. Oops. Another modality that has become increasingly popular is Reiki. It's even being used in hospitals around the country. Many nurses are being trained in Reiki. It comes from Japan. The word Reiki means life energy, and you can kind of see the correlation that Ki means energy. It's similar to the Chinese word qi, the Qi, and it's not rooted in any religious system, but it's based on the premise, similar to acupuncture, that we have energy running through our body, and just like our physical body needs some tweaking or treatment, the belief in these ancient systems is that so does our energy body. And it might sound a little far-fetched, but when you think about it, we've all had an experience where maybe we pick up on energy. Maybe you walk into a room and you can tell there was just an argument. You don't know why. Whatever, for whatever reason, something feels off. Or you're somewhere and you can tell someone's looking at you, and you turn and sure enough, there's someone right there. These things aren't fully understood, but it doesn't mean they don't exist. And so Reiki involves a practitioner doing a series of hand placements down your body. Sometimes it's a gentle touch, sometimes it's just hovering. And it's really great. Maybe you are someone who has been battling frequent fevers, but you would still like to experience that holistic care. Reiki might be a good time. This might be a good time for you to try something like Reiki. Or if whatever your treatment is doing, maybe your neuropathy is so bad that the thought of anyone even touching you is like, no way. Reiki could be something you could try. There's a lot of power in two people coming together with an intention. And again, it sends a message to your body on a cellular level that you are cared for. There are real chemical reactions. So these are just things, not all of them will resonate with you, but think about ones you might want to bring into your treatment plan. Another one that's also been around forever is reflexology, based on the premise that we have areas in our feet, our hands, our ears that correspond to other parts of our body. When stimulated, again, it creates balanced energy flow through these channels in your body. Many people simply find having their feet especially worked on relaxing. Your feet have something like over 7,000 nerve endings. So when you have your feet worked on, it can kind of give you a whole body effect. And again, this could be helpful for folks with neuropathy, helpful for folks where if there was a situation of a lot of tumor involvement, the feet are generally still, as long as you're walking around, your feet are experiencing pressure. So it's generally always a safe bet having your feet worked. A few other complementary approaches, which we could talk forever about. Aromatherapy, incredible science emerging about the power of these plant compounds and how they are tied into our olfactory system, the part of our brain when we inhale an aroma. It enters a part of our brain that also has a rapid switch from stress to, okay, I can cope. This is, your sense of smell of all your senses is the quickest way to get there. So much so that years ago, scientists used to call that part of the brain the rhinencephalon, which means nose brain. So these things aren't just frou-frou, they're real tools that nature has provided that can improve our quality of life. Culinary medicine is incredible, the use of herbs, spices, medicinally, but it's also fun to work with. You can make your food taste good. If you think back to when you were a kid, if you had a bellyache, maybe your mom gave you ginger ale. So this really isn't new stuff. It's been around forever. Sound therapy, perhaps you've experienced Anne Grace's bowls. Again, there's an incredible book called Sound Medicine, written by an MD who took a deep dive into the science behind how sound affects us on a cellular level in a positive way. And we know sound is used in modern medicine as well, ultrasounds, and it's being used in other ways to treat illnesses. So take time, just listening to music and singing. It is such a great way to shift our body chemistry. So don't underestimate the power of these things. This slide I just wanted to show, this was from most of my time. I've worked in the adult population, but this is from a magazine put out by the Children's Hospital of Philadelphia. I had the opportunity to work for a couple of years in their integrative health program. And the young man in this picture, his name is Mason, and he had a lymphoma diagnosis. But you can see here, he was so open to trying all of these things. He said that on his treatment days, he was often scared and sad, but on the days where we would create a plan where he could have massage, yoga, acupuncture, he verbalized that he slept much better on those nights, that he felt calmer inside, and that his symptoms decreased. And so I wanted to show this too, to show that a Children's Hospital is usually one of two in the top pediatric hospitals in the country. They do not bring things into the hospital unless it's well supported with quality research. So I just wanted to mention that. Hospitals slowly but surely are bringing these into patient care because they are effective. We live in the best of both worlds, where you can have all the benefits of modern advances in treatment, but you also have access to these other therapies that help fill in the gaps that modern treatment can't get to. So I encourage you to take advantage of all of these things. Craft your own plan. And then this last slide are just a couple of books. I could probably put about 20 books up here, but this first one is called Integrative Strategies for Cancer Patients. It's great for both healthcare providers and folks with Waldenstrom's diagnosis or other cancer diagnoses. Just like I showed you that acupuncture point, it's going to show you points for all kinds of different things, not just from acupuncture. It will show you yoga postures. It will get into some herbs and spices, reflexology points, things you can try at home that you don't need an appointment for, that you can try yourself. The next book, Mind Over Medicine, is interesting. It's written by a doctor who started to take a look at what makes one patient do better than another. Same diagnosis, same treatment plan. And so she really started to develop this concept of what is whole health? What are all the other things going on in this person's life? And encourage her patients to write a much broader prescription for themselves. And then the last book is How Your Mind Can Heal Your Body. It's not at all a suggestion that you can just think your way out of illness. Rather, it's encouraging you, along with the treatment you're getting, to not neglect things like visualization. There are many studies presented in this book where folks in physical therapy, in addition to doing their exercises, they also spent time visualizing. doing the exercises or watched videos of it. And folks in those study groups, their progress was exponentially better than the folks that didn't use things like visualization. So draw on the built-in tools in your body, find practitioners that can work with you. There's an organization called Society for Integrative Oncology, SIO.org. There's also Society for Oncology Massage. These are resources that might help connect you to a practitioner. Thank you all for being here and for your attention. It has been wonderful to be here the past 2 days, and I'm super grateful to IWMF for allowing me to share this information.